Yeah, this is an epic win for the defense. And I do want to just walk through a little bit of how the technical law plays into this decision, because it's not simply just the judge deciding, hey, I don't think the death penalty should be eligible in this case.
Holy guys, this is a big deal. A huge deal. A much bigger deal than just getting rid of the death penalty in and of itself. You see, the American legal system is complicated. The butterfly effect is a real thing, and this could be the first flap of the wings that causes an absolute hurricane. You see, this not only means that the death penalty itself is off the table, it could set off a chain of events that leads to either a not guilty verdict or at the very least a mistrial. In any case involving the death penalty, the jury that's selected for the case must be death penalty qualified, meaning they can't have any moral objections to the death penalty itself, as that could potentially influence their bias. And a juror who's morally in favor of the death penalty in the first place is just statistically more likely to vote guilty in the first place, as they're generally likely to be harder on crime. This is another reason the prosecution was so vehemently pushing for the death penalty, even though it was a clear and adamant overcharge, and evidently the judge agreed as well. This has even bigger ramifications when you consider the fact that jury selection was already going to be a massive headache for the prosecution in the first place. Everyone's already heard of this case by now, and finding 12 people who haven't been screwed over by the American healthcare system is going to be a monumentally tall task. And now that the defense is guaranteed to get a much friendlier jury, well, this significantly increases the odds of the infamous jury nullification. It's a scenario that we've talked about before on this channel, and or more likely perhaps a hung jury and a mistrial. So, with all that being said, I'd figured it's a good time to dedicate this video as a sort of American healthcare hater manifesto. Part 1. The history. Okay, so first, some context here. When I'm railing against the American healthcare system here, I'm specifically criticizing the for-profit capitalist model of it. You see, throughout history and even in the modern day, the for-profit model simply does not work when it comes to the issue of healthcare. And this is why, in my opinion, healthcare must be a socialized public good. To keep this conversation productive, let me emphasize that we are only talking about healthcare and healthcare alone in this video. We're not talking about socializing the economy as a whole or anything like that. Now, most public health historians agree that the sudden sharp and rise in global life expectancies was primarily due to three major advancements: sanitation, aka clean water, germ theory, and vaccines. So let's do a full, detailed, fair, and objective breakdown of these three medical breakthroughs to see what role, if any, capitalism played in it. So let's start with sanitation. I've covered this issue extensively in another video I made about life under capitalism during the Victorian era. This specific time period was a capitalist wet dream. No regulations, no minimum wage, no pesky child labor laws, no Fed printing money, all the stuff you hear capitalists blaming the current system on today. Giant factories dominated the skylines of London and created one of the absolute worst health conditions, bar none, in all of human history. In the Victorian era, the average life expectancy for the average working class individual in some districts was a stunning 18 to 19 years old. These factories caused catastrophic levels of pollution in the sky, toxic chemicals in the water, and human waste on the land. Now, not by coincidence, this also marks around the beginning of the era when life expectancies around the world begin to rapidly shoot up. So, did capitalism cause this? Well, yes, but not in the way you think. The atrocious public health conditions caused by these capitalist factories of death became so horrific and unavoidable that eventually the state and overall community had to come together to decide they had to do something about it. The first step was to install a citywide sewer system. Before modern plumbing existed, managing human waste was a massive problem for just about every previous society. Now, this was especially bad in Victorian era England, where millions of people were forcibly kicked off their farms with the Enclosure Acts and shoved into cramped cities with no modern toilets. When the first citywide sewer system in London was finally complete, this dramatically improved the sanitation and was the first step towards the universally better public health living conditions we live under today. So let's pause and ask a very honest question here. Was the construction of the first sewer system a capitalist innovation incentivized by private corporations and a for-profit model? The answer is a big, unequivocal no. In fact, the capitalist business owners at the time were actually vehemently opposed to this because a citywide sewer system was not in any way beneficial in a for-profit context. It would require lots of state planning, much higher taxes, and an incentive structure based on empathy and compassion and not capitalist profits. All these things you hear capitalists constantly complain about up until this day. Now, despite their vehement opposition to the project, the community and state decided that the project must go on because, well, drinking out of the same river you just shat in is simply not something that's acceptable. So, as I said earlier, capitalism did in a way lead to better public health conditions, just not in the way you think. The causal link here is that capitalism caused such awful, horrific, disgusting health outcomes that the state and community at large were forced to come up with a countermeasure to clean up the atrocities of capitalism. And they had to fight tooth and nail to push it through despite vehement opposition from capitalist business owners. Markets straight up just tend to underprovide sanitation because benefits spill over across all of society and poor households can't afford to pay up front, so you almost always need some sort of public finance and coordination. Hey guys, you may have noticed we're getting very close to 50,000 subscribers now. This has always been a huge milestone in our eyes, so if you're new here and enjoying this content, definitely consider subscribing and helping us get closer to this big magic number. Thanks a bunch, you guys are the best. Germ theory. We take it for granted as being super obvious today, but believe it or not, for the majority of human history, people didn't know that little microscopic organisms actually cause disease. They knew and experienced disease on a daily basis, but they had no idea what the cause of it even was. And so, as you can imagine, this made any form of healthcare in the past significantly harder, as they didn't even know what the enemy they were up against was. Ignaz Semmelweis, Louis Pasteur, and Robert Koch are the three individuals who are most credited for the discovery of germ theory in the mid-1800s. All of their research was funded by grants from the government and not private corporations. And there's a good reason for this. Germ theory is knowledge and not a commodity. Once it's publicly known, it's freely available for everyone, and you can't put it behind a paywall, as capitalists love to do with everything. This is why capitalists not only did not help their research, in many cases, they actually actively tried to sabotage them. Louis Pasteur first discovered that microbes cause fermentation and spoilage in response to a massive wine and beer spoilage crisis. This was a national economic problem and not corporate R&D. Robert Koch was funded by the state for the purposes of national health reforms, not private for-profit ones. In the case of Ignaz Semmelweis, not only did capitalists not help his research, they actively tried to sabotage him, as his research would have proven that their for-profit doctors were actively killing patients. Vaccines. You know what smallpox is, how devastating, lethal, and horrific this disease was. Thankfully, if you are watching this video, you've likely never lived in a world where you had to live in the constant terrifying fear of smallpox that plagued nearly every civilization that came before you. So, who should we thank for this? Was this the innovation of a capitalist for-profit enterprise? Once again, the answer is a massive, resounding no. Now, to be fair, unlike sanitation and germ theory, capitalism didn't eradicate smallpox. It certainly did not. But it didn't necessarily make it worse either. In this case, it was more just of a neutral, unbiased bystander. The eradication of smallpox wasn't just a nonprofit community-driven initiative, it was an entire globally coordinated nonprofit initiative funded by the WHO, who freely, yes, freely gave out smallpox vaccines to millions of poor, vulnerable children who would not have had the money to pay for it if it was done in a for-profit capitalist context. Now, I get that some of you have bad vibes about the WHO and vaccines after what we all went through in 2020, and whatever, that's fine. I'm not going to argue with you about that. That is not what we're talking about here. If you think the smallpox vaccine wasn't necessary and an objectively good thing for humanity, well, there are still 2 highly secure locations in the world where a small sample of the smallpox virus are still kept for scientific research purposes. Let's say you put your money where your mouth is and pay one of these locations a visit without getting a smallpox vaccine. Yeah, somehow I already know none of you complaining about vaccines are going to go out and do that. So you may have noticed a consistent, broad theme here. When it comes to the issue of health, and health specifically, for-profit models just never have and never will be viable. At best, they don't help, and at worst, they actively slow down and even sabotage progress. Poor people need to be included in the system just as much as anyone else. And even if you don't care to do it for morals and empathy, you have to do it out of simple biological facts and reality. Contagious diseases are indiscriminate, and they affect all of us if we don't make a global, collective effort to stamp them out. And this is also why I laugh at delusional boomer morons who like to throw out the whole healthcare isn't free. You're just changing who has to pay for it. As you just saw, the entire history of medical progress was built upon people and communities gathering together to deliver medical services to everyone in the world for free. Yes, for free. These are all historical facts and not opinions. If you think you personally worked for or paid for everything from the sewer systems to germ theory to all the billions of free vaccines that eradicated smallpox, well, you just have a beyond insane and delusional, narcissistically high opinion of yourself. You yourself benefited off the free labor of countless scientists and health organizations who worked tirelessly to eradicate all the horrible diseases you'll never have to experience, and just about all of them did it in a non-profit context. A lot of these people have even explicitly stated that healthcare is indeed a right and should indeed be free. Part 2, the modern day. I spent a year living in Paris, France, and had extensive experience with the #1 ranked healthcare system in the world. And I'm about to tell you all a story that should make you very jealous and very angry if you're an American. When I first landed in Paris, I got a pretty bad cut on the back of my neck from playing a pickup game of basketball. My insurance paperwork had yet to come through, French bureaucracy is notoriously slow, and so I didn't take care of the cut very well, and it morphed into a pretty nasty staph infection a few days later. I knew I needed to see a doctor, but I was scared of how much it cost as I didn't have my insurance yet. So my host family recommended me to a cheap state-funded doctor in a modest facility. And after waiting just a few minutes in line, the doctor saw me, we had a friendly chat, and he gave me a simple disinfectant to clean up the staph infection. And that was that. Then it was time for payment. And as an American, I was really holding my breath when I told him that I was currently uninsured. He ended up charging me 20 euros. Yes, only 20 euros. And he even told me that I could get a 13 euro refund whenever my insurance came through. And at that point, I was just like, you know what? Don't even worry about it. You can even just keep it as a tip at this point. This was far less expensive than any copay in America, even if you had insurance. A good family friend of ours in America recently told me the shocking news that one of her neighbors unfortunately got cancer. The woman is in her 30s, younger than me. She just had a kid, and they're telling her she has to wait 3 months. Yes, 3 months for an initial cancer screening, despite the fact that she actually has insurance. The biggest shocker for me was that wait times were supposed to be lower in America. This is the signature singular talking point you always hear from those looking to defend the broken American healthcare system. Oh, we can't have socialized healthcare. The wait times are so long in those countries. And yet, here in America, with a life-threatening cancer, she has to wait 3 months just for an initial screening. And I always accepted this narrative because, well, it kind of seems logical on the surface level, right? If everyone gets it for free, of course you're going to have to wait longer, or so it would seem. But after hearing this anecdote, it made me really question this narrative. And so I dug into some empirical research and data. What I found was shocking and again should make you very angry as an American. The front and center biggest problem with the wait time argument is that they simply don't count all the people who literally just died waiting. 45,000 Americans die every year while waiting for life-saving medical treatment. And hilariously, these just don't get counted in official wait time statistics. We also don't know exactly how many poor people in America had other general health problems and simply never bothered to see the doctor because they know they can't afford it. When you systematically exclude millions upon millions of poor people from accessing healthcare, well, of course, wait times are going to be shorter for the few rich people who can still afford it. So as you can see, claiming that wait times are lower in capitalist for-profit systems is just blatantly false and misleading to begin with. But beyond all that, even if I were to grant you that the for-profit system and all these blatant misleading ways of tracking statistics, even if I were to grant you all that, wait times still aren't really even lower than in countries with a single-payer system. US wait times are generally shorter for existing patients getting routine appointments. For new patients, however, it is a substantially, exponentially longer wait. Here's a study which looked at average wait times in the US across 11 different medical disciplines and found that the average wait time was a staggering 38 days, nearly 3 times the recommended industry standard of 14 days. There's another popular statistic claiming that US emergency room waits are only 24 minutes, while in Canada it's over 2 hours. But once you dig into the research, you find that the methodology was once again manipulative and dishonest. The metric they use only measures the time it takes to get the very first assessment and not overall time spent in the ER. Once you factor in overall time spent, it becomes a complete different story. Only a total of 30.5 of EDs achieve the triage target for more than 90% of their patients, and only 13.8% of EDs achieve the triage target for 90% or more of their patients' triage to be seen within an hour. A result that is mediocre at best for the US healthcare system. And here's the thing, mediocre would be acceptable if we were paying mediocre prices, but every American knows we're not. In every other developed country on earth, an ambulance ride is free. In America, it costs thousands upon thousands of dollars. And contrary to what they want you to think, no, the wait times are not any better, and we just statistically proved it. But then this all begs the question of why? Why and how is this possible? You would think that by excluding so many poor people out of healthcare services, the one upside that theoretically should be there is that wait times should, in theory, go down. So why is that not even the case in America anymore? Well, the answer lies within another dystopian hellscape mechanism of American capitalism: college. Just like with healthcare, college has also become way too absurdly expensive for most Americans, while in other countries it's either free or extremely affordable. This means that on a per capita basis, the United States has significantly fewer doctors than any other developed country. There's only 2.7 physicians per 1,000 people in the United States, woefully below the 3.9 OECD average. In comparison, Germany has 4.7, Austria has 4.2, and Norway has 5.0. It turns out that a lot of prospective young doctors see the exorbitant cost of medical school debts in the US and make the logical and rational decision to pursue a different career. There's also the fact that due to all the billing and insurance related paperwork required in a for-profit system, American doctors are bogged down heavily by having to spend a lot of time processing payments, doing general admin tasks, instead of actually being able to see patients. One study revealed that the average American doctor has to spend 15 hours per week just doing payment processing tasks alone. This is 15 hours they could have spent seeing a patient, logging in more appointments, and, actually healing people instead of doing financial paperwork. And finally, we have the fact that because the healthcare system in America is so damn expensive, so many people, even insured people at this point, are put into a situation where they have to skip recommended care in order to pay bills. This leads to a situation where they put it off until it snowballs into a much, much worse health problem that requires significantly more expensive, time-consuming, and complicated healthcare. Conclusion. So, as you can see throughout history and in the modern day, healthcare just isn't something that should be done in a for-profit capitalist context. And this isn't even one of my general anti-capitalist rants here. I'm totally cool with markets if we're talking about selling iPhones, video games, fancy clothes, or whatever other luxuries, but not when it comes to human lives. This is just not something that should be commodified, period. Now, jury nullification aside, there's another bigger problem with this case of the prosecution, and is a very interesting reason for why Luigi Mangione could just walk free an innocent man on the day of the trial. And it has to do with a very, very massive, huge mistake the police made when they searched his backpack without a warrant. We cover this more fully in this video right here. Check it out. I'll see you there. Thanks for watching.